Doctors of Reddit, what's the most miraculous recovery you've ever seen in a patient? Dead for all money, been lying in bed on death's door for days, hasn't eaten, hasn't moved his head, hasn't spoken, hasn't even looked at you, sits bolt upright and says we got them, then lies back down and dies. I mean, it was short-lived, but very unexpected. Stroke patient. One side of his body was paralyzed. He walked out less than a month later. No physiotherapy and no permanent damage. Guy's over 80. I'm just an EMT. I once witnessed an 80-year-old woman go from conscious and talking to working code, no pulse, not breathing, to pulse but no breathing, and back to awake and oriented with zero memory of her 8 minutes of pant-sitting terror. We never initiated CPR, pushed no drugs, and only gave her a few breaths from a BVM. My father is a doctor in family practice. Our area has a high rate of diabetes. When a patient gets diagnosed, a certain code is put on their record. A few years ago, a typo in the system led to the code for diabetes being the same as dwarfism. So for that entire year, my town had the highest rate of dwarfism in the country. Nurse here. I have a pet starling. I'm on my third one. My first one used to sit on my shoulder everywhere I went. To the store, my parents' house, and even work. I'd bring him in on my days off to entertain the patients, especially the old folks and kids. Had a woman in with bilateral strokes. She was paralyzed on both sides and was totally immobile. My starling hopped on her belly and she concentrated as hard as she could and was able, for the first time in many days, move her left hand up to pet the bird. That was the start of a pretty amazing recovery. She never walked again, but got the use back in her arms. Nurse here, not a doctor. I remember distinctly a guy in his 90s with a lot of comorbidities from a nursing home. Placed him in a side room cause he was chain-stoking, death rattling, grey with purple mottled peripheries, vital signs awful, the usual. Go to check on him half an hour later expecting him to have passed. Nope, he's got about half a liter of sputum all over his chest. He's alert and all his vital signs are now fine. Was discharged a few days later. My brother had meningitis as a baby. From that he had mild brain damage in the frontal lobe. He had poor motor skills, decision making, incredibly irrational. At 18 he couldn't hop, terrible balance. He couldn't click his fingers. He struggled to catch a ball. 18 years old he is found collapsed in our house. Ambulance is called. He had meningococcal. 6 days in a coma. He doesn't cooperate with the physios, puts very little into his recovery. The meningococcal caused more damage to his brain. Whatever happened this time reversed the previous brain damage. He could click, hop, play ball. He is now a stand-up surfer. His decision-making abilities and everything else are normal. He's one of the best engineers in his field. He is incredibly successful and talented and such a driven human being. All of this wouldn't have happened if it wasn't for his brain being further damaged. We are stationed in a very remote area, so some conditions usually treatable or manageable in hospitals with adequate facilities are far more serious here. There's one recent guy that come to mind. The patient was clinically suspected to have an intestinal perforation. The astonishing thing was he had been symptomatic for 8 days. He did not mention why he sought treatment so late, but my bet's on his financial situation. We were surprised he wasn't dead already. His lab reports from the ER were haywire. He was planned for surgical repair in the ER and had to wait another 16-18 hours for his turn. There's just one OT. When we saw him prior to surgery the next day and noted his status, we were fairly certain he would not make it back from the table. After thorough counseling, we got a high-risk consent from the family. A kind surgical resident offered to pay for the procedure for the time being. In op, he had a sigmoid perforation with gross fecal contamination. The repair was successful, but anesthesia could not extubate him. He needed an ICU bed, which we did not have, all taken. There was a hospital with an ICU bed an hour's drive away. They loaded him in a vehicle, with a family member bagging him and monitoring a noradrenaline drip titrated to last almost exactly an hour. Drip goes too fast and the drip's gone. BP gone and patient gone, and a family member was looking after that all the way. He made it though. I will never understand how. There's some that we lose so unexpectedly, and some that just refuse to go. My uncle came back from a stage 4 cancer. He looks better than he ever did, and I think the cancer made him less of a prick. I had a young woman who came in septic from pneumonia, on full inotropic support, still deteriorating. Adult retrieval assessed her and declined our request for ECMO because they thought it was futile. The pressures required to ventilate her caused a tension pneumothorax. She arrested 3 times. Ended up ventilated for 2 months. Multiple failed attempts to wean her off because of critical illness myopathy. Eventually, after a 4-month stay, we got her to rehab. Sickest person I've looked after who lived. I've needed to read this today. Have a patient on the inpatient floor right now who is pretty close to passing. Family is in denial. Makes me feel like a failure sometimes. These stories help me keep going. Screw it. I'm a doctor and I'll weigh in. I treat brain aneurysms, strokes, and a few less well-known things by working from inside the blood vessels. Lady had an aneurysm pop. She was the highest grade in both state and consciousness and amount of blood. Hunt has 5/Fisher 4. 10% chance of survival. And basically all of those are neurologically devastated if they live. Most of the time we don't even treat the aneurysm, they are doing so bad. She comes in. Intubated, no corneal, eye blinks when you touch it, or no gag reflex. Both of these are low-level basic brain stem function, usually the last to go before someone dies. I think one pupil may even have been dilated. She's basically dead. Have family discussion. They understand. We wait 24 hours. She basically turns the corner the next day. Decide to treat aneurysm 48 hours later. But all of us are like, WTF. How is she doing this well? She had a long road with pneumonia and bowel obstructions and scattered things. But she left hospital for rehab pretty intact. I'm a knob. And I delivered a baby with newborn leukemia. This baby looked like it had no chance of life with her enormous belly of ascites, hydrocephalus, leukocytosis off the chart, and so on and so on. This baby was transferred to a university and started on chemo at 1 day of life. I saw the baby at 6 weeks and was completely cured and normal in appearance. Patient with chronic depression with suicidal ideations. No meds worked. He tried all for over a decade. Sent him for a sleep study. Obstructive sleep apnea was identified. Put him on a CPAP. His whole life changed. He was really thankful to feel good again. He teared up when he thanked me. I saw a patient that suffered from 10 multiple MRSA infection combined. All the blood work is it. Expect him to die within 2-3 days. Walk out from the hospital alive. He is young though, only 23. I got one. I had a patient that went into cardiac arrest and was found in refractory VFib. It means his heart wasn't pumping and was just quivering like a big ball of jello. Normally this is fixed by shocking it and typically converts after 1 of 2 shocks or they flatline. This dude spent 45 minutes getting CPR and was shocked 15 times on the way to the hospital. So his heart was basically stopped for an hour. He was brought to the cath lab, put on ECMO, which is a heart-lung bypass machine, and 2 stents were placed. He walked out 3 days later. To this day it's one of the longest instances of someone being in VFib and surviving. Less high-tech than some of the other doctor stories. But I agree. Sometimes the body just refuses to give up. Sometimes it's so tough. And sometimes something trivial will finish it off. Last week one of my normally chirpy 96-year-olds at home was less well. That's all. No symptoms. Nothing to help me diagnose. Nothing in the chest. Nothing in the urine. Blood tests unlikely to help. Semi-conscious. Non-clinicians. The elderly can be really sick without a fever or a fast heart rate as in a younger adult. I judge that a dramatic response would be inappropriate. That is, sending him to life for 5 hours on a cold stainless steel trolley in the ED, and then die. I hold his hand and make him smile weakly by telling him little jokes. Tell him we're going to help him. Discuss his impending end with his family and decide that it won't do him any harm to give him a broad spectrum antibiotic. Well, it can. But that's another story. So I do, and 24 hours later, he's out in the garden in the sun on his pool chair, listening to the radio and talking about politics. He's back to normal. Not a doctor, work in insurance. A guy was ejected from a car that hit a tree and was diagnosed with a closed decapitation. basically meaning that the spinal cord had been severed. The only thing keeping his head attached was the skin and tissue. The guy lived after some crazy surgeries. EDRN chiming in, we had a morbidly obese patient who went down at work. She was very lucky in that she had co-workers who had CPR training, paid for by their company, and knew how to use the ED in their office. She was with us for a whopping total of 15 minutes before we zipped her off to the cath lab. No one thought she was going to make it. She was out of the hospital within a week and sent us and the EMS crew a thank you basket of fruit. I really hope that she got her co-workers something, because without their immediate action, there isn't a doggone thing that any of us could have done. Source: I am a doctor. Residency in a large hospital in Toledo. Had a patient come in with a simple pneumonia. In and out of the hospital in 2 days. How is this a miraculous recovery? Good question. She had gone home to die with hospice 2 years prior. Biopsy proven small cell lung cancer. With treatment most don't survive 5 years. Most are dead in less than 2 years. She had no evidence of any cancer in her. Masses and nets seen before all gone. Family reported she hadn't tolerated the pain mess given by hospice. And no, this isn't a pot ad. She didn't smoke pot for relief. She went hardcore crack sugar for her relief. And we couldn't find a trace of the cancer that kills practically everyone who gets it. And kills them fast. There's no doctors weighing in, so I'll share a story. My grandfather, he was in the worst car accident you can imagine. The whole one side of his vehicle, the side he was sitting in, was smashed to basically nothing. Had to go into an induced coma, and then once he recovered, he had a metal plate placed in the side of his face. Though we truly believe the car accident, due to the nature of head injuries, caused his early onset diagnosis of Alzheimer's. Car accident in his 40s. Died at 67 from Alzheimer's. Intelligent man. Missy Pop. Requisite: I am not a doctor disclaimer. In 2003 I found my dad unresponsive and basically comatose in bed. He ended up spending 5 weeks in a coma in ICU due to acute respiratory distress syndrome, sepsis, multi-organ failure, congestive heart failure, pulmonary embolism, black lung, DVT, and so many other things. His blood oxygen level when I found him was 32%. The doctor said that he would not live. Then they said if he did live he would be a vegetable. When they started to ease him out of the coma, it became clear to me that his cognitive function was not impaired. Once he learned that he had a breathing tube, he asked via pen and paper when he could get it out. The doctor said they were going to do a tracheotomy so that he could breathe, and my dad refused. The next day when the respiratory doctor came, he was walking around holding his ET tube. He was extubated and moved to a rehab facility for several weeks to learn how to walk again after having 150 pounds of water taken off of his body. He was able to fully recover and return to our home. He lives alone and has zero deficit or function issues. Not a doctor, but my uncle became famous in the hospital for his miraculous recovery. I don't know exactly what he had, but I think it was a virus or infection in his brain. They didn't know until it was too late though. He was in coma for a month or so. Didn't remember his wife and 2 kids when he woke up. He could hardly talk outside of muttering a few words now and then. It basically seemed as a lost case. Now he remarried and we recently welcomed a new baby in the family. He's perfectly healthy now, talks and walks as fine as before, outside of the epilepsy as a result of it. Had an extremely frail, sick woman suffer a minor heart attack in hospital, and was unconscious after. Her family was there. We spent a long time talking about how sick she was and how this was likely the end. Just as they were coming to understand, she stopped breathing for some time. I took her pulse and was about to share the bad news when she started up breathing again, woke up, and lived pretty well for another 6 months. I have no idea how she rallied like that. It was damned hard to have end-of-life conversations with that family afterwards. I'm an occupational therapist, and during school I did one of my rotations in a hospital psych unit. My most memorable patient, who was bipolar and schizophrenic, came in one day and was just off the wall, screaming at everyone, threatening suicide constantly, destroying everything he could in his room. After like a week of the doctors readjusting his meds and attending therapy groups, you wouldn't have known anything was wrong with this guy. He got discharged and was just like, okay, thanks guys. See you next time. I gotta go back to work on Monday. Duck, this is a great question. Why are there no answers? Obligatory, not a doctor but a nurse. Used to work in the special care nursery. We get a call from birthing unit. There's a code critical. Cord prolapse. Umbilical cord is hanging out of mum, so bub's not getting oxygen. So start preparing for in the case bub comes to us for resuscitation. Get the call, baby is coming to us. One baby comes through the door. Then a second baby. No one told us they were twins. First twin is alright. He came out not long after the cord, so not much oxygen starvation. Second twin unresponsive. We had doctors and nurses from all over the women's health wards performing resus on this tiny baby for, no joke, close to 5 hours. Doctor in charge almost called it because they just weren't getting a response from the kid. Finally they bring the baby back and stable enough to be transferred to the NICU at one of our other hospitals. Dad came in the next day to pick up the first twin. They couldn't be taken to NICU 2 as they didn't meet criteria, and told us mum and the second twin were doing well. My brother had what's called an AVM, which just means his brain has extra veins in his head. They're typically weaker, which means they can bleed on the brain, which is a bad thing. No warning unless you have a scan for some unrelated incident. Can't remember if it's MRI or CT scan, but I think it's MRI. Thing burst and he couldn't walk. My parents are old farts, so I had to carry my little brother, who ironically is bigger than me, to the car, and they sped off to the hospital. The surgeon said we brought him in dying. He was in a coma for the next week, maybe longer, but I don't remember how long. When he did wake up, he couldn't talk anymore due to the location of the bleed. The doctor said he could be blind in one eye, paralyzed, or any other number of possibilities with how bad it was. My father said one of his saddest memories was seeing his son, my brother, try push himself in a wheelchair to see his grandparents. No words of happiness due to not being able to talk. No smile. Just desperate pushing to try to reach our grandparents. He lost weight and was just a shell of his former self. It was bad. Within a month he was back on his basketball team and doing great. No one knows how. His speech is still affected, but if you didn't know, you would just think he talks very deliberately. We describe it as it was the worst possible thing that happened in the best possible way. Not necessarily miraculous, but had a guy in it who is the only person I've seen so far classified as super morbidly obese. A young bloke in his 30s but already suffering from heart failure, hypertension and type 2 diabetes. I can't remember exactly what he came in with, but it ended with him respiratory failure. He stayed in it a fair bit, requiring intubation and sedation. Whilst there he lost over half his body weight. Started breathing well again, but more importantly he no longer required any antihypertensives nor diabetes meds. Through an extended stay, he was cured of his high blood pressure and diabetes. Every time I see a patient who has graduated from ECMO and have recovered well, that seems miraculous to me. I had a patient just the other day who had multi-organ system failure, heart stopped, kidneys shut down, and was on ECMO for a couple weeks due to sepsis, and subsequently was completely fine. Normal EF. Off dialysis. The whole bit. She was fairly young though, 30s. Trauma service. GSW to the head from close range. Dragged a hoop earring with the bullet into her brain. Extubated and talking within 2 days. Amazing. Not a doctor, but my dad was in a car wreck in 1984. He was getting ready to pull out of a gas station and had 3 friends with him. 1 in the passenger seat, 2 in the back. He sees headlights coming towards them and pushed his friend down. The car hits them head on. The friends in the back die. His friend in the passenger seat has relatively minor issues, broken arm and bruising, I think, and my dad broke his neck. While he was unconscious, they told my grandma he'd never walk again, and they weren't sure if what damage had been done to his brain. Tiny hospital and they hadn't transferred him yet. Dad tried to get up as soon as he woke up. He was in a state of panic and didn't realize he was in the hospital, and had to be repeatedly sedated so he wouldn't hurt himself worse. My dad is now as healthy as any other guy his age and has his own masonry business. He also has a vendetta against VWs. Attendant here. Guy over 65 gets admitted for losing his mind. Let me explain. Had heavy drinking problem. He's got diabetes, ulcer, blood pressure. Toes in the leg cut off due to injury and non-recovery. Liver and kidney fails. So ammonia starts ducking up the brain. Completely bedridden. Couldn't recognize extended family. A couple weeks into admission. Doctors gave up. Family comes to be with him. They even start informing others. A couple days later, they discharged. I thought he gave in. Nope. One bat. He just decides to walk and recovering again. Ducking beast he was. Not a doctor, but I'm a veterinary technician. We had a senior yellow Labrador retriever brought in by an officer right at the end of the day, who had a 108 Fahrenheit temperature. We immediately put him in the tub and soaked him in cold water with ice packs. I was frequently checking his temperature while the other techs were putting in an IV catheter to get some fluids in him. Once his temp was near 104, we took him out of the tub, dried him off a bit, and brought him to the surgery room. 104 is still high for dogs, but the challenge is to not have him go into hypothermia, because their temp will still drop for a while. Once his temp seemed stable, we were able to get him settled into a kennel for the night. We were all sure he'd had brain damage. He looked very out of it, and acted like he was in pain. Surprisingly, the next day, he was up and alert and just got better every day. Now, because the sheriff dropped this dog off, he was first considered a stray. He had a collar, but the only tag was an old rabies tag that was so worn out, it was unreadable other than the ear. So we called the local humane society so they could pick him up. It only took a day before the owner saw a post online of him. He was able to go back home. My boyfriend's father was diagnosed with a brain tumor in the mid-1980s. His only hope was surgery to try and remove the tumor, and he wasn't expected to live through the surgery. His family decided on surgery. Without trying, he was most certainly going to die. If they tried to remove the tumor, he was almost certainly going to die. He lived through the surgery and led as normal a life as he could after that. His brain functioned exactly as it should have. He had physical side effects from the surgery. Mainly, he couldn't walk like a normal person anymore and couldn't eat normally anymore. You had to cut his food like a child so he wouldn't choke. He went back to work for a while, to a desk job, because he couldn't walk properly anymore and had been a mailman. He is now a case study and is written about in medical journals and textbooks.